Senator from Louisiana.
Mr. President, what we're debating here are two visions of the future of the Obamacare exchange. Democrats want to cover the cost of health insurance to benefit health insurance companies, and Republicans want to cover the cost of health insurance to benefit patients. Now, I can actually kind of develop that idea. If you look at what Democrats want to do, they want to give 100% of the money to the insurance companies, and the insurance company, by law under Obamacare, can take 20% of it for overhead and profit. 80% of it goes to patient care, but of course, you've got to get your prior authorization and permission for this 80% to be spent upon you. On the other hand, the Republican plan is to put the money into the patient's pocketbook so that she has money to pay for the insurance out of pocket. And here, 100% of the money she receives goes towards some sort of health care or dental care or vision care. By the way, that's a distinction. Under the Democratic plan, the insurance company doesn't cover your dental work. They don't cover the orthodontia for your child. They don't cover the eyeglasses you need. And under what we're doing, putting it into her pocketbook, physician, dentist, drugs, vision care, this is a patient-driven account of which 100% is going to the care she knows she needs, and she does not need to seek permission in order to obtain. Now, to put a little bit of a point on it, a 50-year-old couple with children 19 and 20 could get as much as $5,000 in their account. Think of what that means for somebody with chronic disease. If you have diabetes, under the Democratic plan, there's a $6,000 deductible, and someone has to pay $6,000 before they begin to get coverage for everything they need for their chronic disease. Under the Republican plan, putting $5,000 for that couple I spoke of earlier with two children, it's in their pocketbook. They can pay for that which they need for chronic disease. So, what's not to like? I would say that the Republican plan meets Americans where they are financially. Most Americans don't have more than $1,000 in their savings account. Let me repeat that. Most Americans don't have $1,000 in their savings account. The Democratic plan would require them to have a deductible to pay $6,000 before the insurance kicks in. So, let's compare the two plans. The red side is the Democratic plan. The green side is the Republican plan. The Democratic plan is to give 100% of the enhanced premium tax credits to insurance companies. The Republican plan is to give the money to the patient, into her pocket, her pocketbook, her purse, to pay the out-of-pocket for the insurance plan. What can it be used for? Under the Democratic plan, it subsidizes premiums. Under the Republican plan, the patient gets the care she knows she needs. The physician visit, the dental visit, the glasses, the prescriptions, and she doesn't need permission to do it. She does it because she knows she needs it. Who makes the decision? Anyone who's fought with insurance companies over prior authorization knows the golden rule applies. The one who has the gold makes the rules. And the insurance company makes the rules as to what you can get. And by the way, that does not cover dental, orthodontic work, eyeglasses, and other things. Here, the patient decides. The patient has the power. It's not profit to insurance companies, it's power to the patient. And if she needs eyeglasses, she uses this money that we put into her account to purchase. If her child needs to go to the dentist for dental cleaning, she can do that. Does it lower cost? Well, if you give the money to the insurance company, clearly it is not. Because since the Obamacare law passed, costs have exploded. But studies show that if you give the patient the money in her pocketbook, she is going to shop for the best deal. She's going to say, wait a second, the x-ray costs $50 here and $500 there, and the difference can be that much. I'm going to go to the place where it's cheaper. Now, as soon as everybody starts going to the place where it's less expensive, the place that is more expensive lowers its cost. That has been shown empirically to work. The Republican plan gives the patient the power to shop, the power to take advantage of price competition, and that lowers cost. One more thing. How does it work with a low-cost bronze plan? Under the Tax Cut for Working Families bill, Republicans passed a law saying that health savings accounts, just kind of putting money in the pocket, can work with a bronze plan. So if you give the money to the bronze plan, permitted under current law, the patient now has the ability to purchase a cheaper plan on the exchange, saving thousands of dollars relative to the plan that Democrats want to force somebody to buy. And what we've seen under the current system is there's all kinds of fraud, there's all kinds of unauthorized enrollment costing taxpayers billions of dollars. Now, it's been said that somehow Republicans are supporting junk insurance. And you gotta laugh. Mr. President, you gotta laugh. Republicans are using the same plans on Obamacare that Democrats fought for. We are merely taking the framework set up on a unanimous partisan vote by Democrats to create these plans on Obamacare, and that's the one we're using. So for some to call those junk plans, kind of like saying we gave the American people junk. I would argue the Republican Party is making these better. Look at this. Under the Democratic plan, there's a $6,000 deductible. Imagine the housewife who has to take her child into the urgent care center and knows she doesn't have the money. This is a cartoon, but in that cartoon, there's real stress and anxiety for that mama who cannot afford the care she knows her daughter needs. Look at this one, the Republican plan. She's got money in her pocket. She's got money in her account. She's got money in her pocket for the insurance out of pocket. And if she starts off with money in her purse to pay for that need, why can't people see that's where the American people are? If the average American family has less than $1,000 to spend, and our plan puts thousands in their account to pay for the health care they know they need, what is the objection to that? Now, by the way, I think we finally found the objection. There's a concern that Republicans are somehow interjecting abortion politics. And I will point out that Democrats have voted for appropriations bills with high protections since the 70s. For over 4 decades, Democrats have voted for language on this issue, and suddenly, they're shocked. So instead of giving this patient the money she needs, it's going to be sacrificed on the altar of abortion politics. I say go with her. I say support her. Let's go to the last slide, please. We need to make health care affordable again. One, we know that the Democratic extension will not pass. It's going to stick people with $6,000 deductibles. It does nothing for fraud. It is not a solution. What we need is not, by the way, I'm also going to say this. I'm obviously saying we don't need the Democratic solution. My Democratic friends will say they don't like the Republican solution. Let me argue that we try and get an American solution. Not an R, not a D, but an A solution. And if we do so, let's give power to the patient, not profit to the insurance company. Let's make health care affordable again. And with that, I yield.